Okay, this one is your eye and vision assessment. So we will be practice that in the lab when you get back from fall break, but you will do a lot too out with the health screenings. These are just different that you do in an external exam. Some parts of these others you will do. Just so you remember, you're looking at your lids, which we will cover. This here is your Snellen chart that's checking for visual acuity. You were looking for pupillary function, so you're looking for reaction, muscle motility, movement, function. We will talk about glaucoma and cataracts, but we're not doing the whole ophthalmoscope looking into pressures and things. This is the intraocular pressure with a nurse may do to check those pressures. You're checking pressures for such things as glaucoma. Checking visual fields, one of the signs for glaucoma, or even macular degeneration, which we're not going to go into, but you will lose your peripheral vision. This, watching for eye movement, also for accommodation, which we will cover. So your external eye structures, just to be familiar, and your upper lid. So when we talk about different things, that's the conjunctiva in here should be nice and pink. That's your sclera is your white of your eye. The color aspect is your iris. Here's your pupil, which you have a lens over your pupil. The lacrimal sac is where you're forming your tears. So I decided to give you pictures, because pictures speak 1,000 words, to help you with terms to understand. Ptosis is that drooping of the eyelid. Remember, some of these terms I did not put at the end because they have them listed here. So your ectropion is here, where the lower eyelid is loose and it droops down. It doesn't necessarily, as you can see in all of these, it may not affect both eyes. It may be one eye. You see the eyelid drooping here, ptosis. Entropion is you see the bottom lid is actually turned in. Entropion. More pictures here, some external things. Blepharitis is an inflammation of the glands and eyelash follicles along the margin of the eyelid. You can see right here, blepharitis. Chalazion is an infection or retention cyst that's in the gland. See here, a beady nodule on the eyelid. Herdolium, which is one that you've probably heard called sty eye. You see it right there. It's a red, painful pustule. It's a localized infection of a hair follicle. So here you have a pustule, herdolium, or sty, and the chalazion is an infection or retention cyst in the gland. It leaves this beady nodule where this is a pustule, and blepharitis, that inflammation with that drainage on the eyelid or where the eyelashes are. Conjunctivitis, there's bacterial, viral, and allergic. Conjunctivitis is that inflammation or infection of the conjunctiva. And it said it could be bacterial, it may be allergic, so it's not necessarily an infection, but it's that redness, inflammation of the conjunctiva in here, and often you have the sclera turning red, or people will refer to it as pink eye. So bacterial has that purulent drainage with it, but that's what conjunctivitis is. Glaucoma and cataracts. Glaucoma is more than one disease, but it has to do with intraocular pressure. Excuse me. which you will study more in med-surg, but the pressure that builds up on these optic nerves affects the vision, may have a loss of peripheral vision. Here, the glaucoma, because there's pressure behind on that optic nerve. This was a good picture. You see how the sclera is so red because the pupil, everything is protruding out because the eye pressure is significant. And then you have your cataract, which is that clouding over of the lens. It's an opacity of the lens. It comes slowly. There's senile cataract is the thickening of the yellow of the lens that comes with age, but there are more than one reason for cataracts and can be in different ages, but you go look at the lens and you will see that opacity. You can't see through it. It is not clear. Okay, so here, arcus senilis, I thought would be good for you to see because in the nursing homes, you may see this. Comes with age. It is actually all the way around that arc. It's a gray-white arc or circle around the iris, and it's common with aging. Here's one that's good that you can see a cataract, which you may see those in your clinicals also, where instead of that clear here, the lens is opaque. Okay, so examining the pupils. I briefly covered this in class, but I wanted to make sure that I really came across clearly. Is your cranial nerve 2 and 3 have to do with your pupillary reaction. You will document them as PERLA, pupils, equal, round, reactive, and accommodation. So I have some more slides that talk about, to show you pictures of pupillary reaction. We'll practice in lab where you're going to take the light come from the outer aspect in on one eye. You expect both eyes to respond. So the okay, so you shine it on the right pupil and the left pupil also constricts. That is called a consensual response. It is what is expected. Accommodation, I'm trying to remember if I have a slide. Yes, I have a slide that covers accommodation more, is where the pupils react to the distance. So as you get closer, the pupils constrict, and as you get further, the pupils dilate, so the lens adjusts to capture the vision. There's really good pictures of the pupils with different terminology that you should be familiar with. So, oh, I have a typo, apologize, that's M-I-O-S-I-S. I didn't realize when I typed it. Miosis, it's M-I-O-S-I-S. I can't fix it on the video, but that is constricted pupils, small pupils. That's not with light, that's just looking at them and they're constricted. Here's how your normal pupils should look. Dilated pupils are mydriasis, and I did spell that correctly, but it's an I in meiosis. And anisorkia is when the pupils are different sizes. This is your accommodation reflex, part of your PERLA. The patient's asked to look at a distant object and then an object close to the face. Both pupils should constrict and dilate again when the distant gaze is resumed. So your pupils dilate with distance and they constrict as you get closer. That's called accommodation. So you have them fix their eyes on your finger and you move it in and you move it out and you watch for the pupils. Exophthalmos is when the eyes are protruding. It's often a metabolic issue, maybe other things. I gave you a couple pictures because this one is so obviously distinct and you may see that at times. Here's one where it's not quite as blatant as that, but I wanted you to understand exophthalmos or protruding eyeballs. You will see that mostly with thyroid. Okay, so we talked on the different type of visual acuity. That's what your Snellen chart here that you'll be using with the students when you're doing your vision screening, and it is a screening for visual acuity, and exactly that, just a screening. The vision is taken at 20 feet, and so your 20/20 says at 20 feet, the person being screened is able to see what someone with normal vision can see at 20 feet. If the person sees best on this line, where at least half of the letters they get correct, the last line in which they're able to get half correct, so for line 5, they'd have to get at least 3 correct to be labeled 20/40. That means that they can see here at 20 feet, they see what somebody with normal vision would see at 40 feet. So their vision is 20/40. If they're down, this is 20/15, down below, that's not listed on this screen, but so if they were able to see line 9, it's 1, 2, 3, 4, 5, 6, 7, 8 items. If they were able to see 5 correct items on line 9, their vision will be recorded as 20/15, meaning they can see at 20 feet what other people have to step closer and be able to see at 15 feet, because your average considered normal visual acuity is 20/20, and up from there. You will cover one eye and record like you'll cover the right eye, you'll record their results left eye, then you'll cover the left eye, record the results for the right eye, then you'll uncover both eyes and record the results for both eyes. Usually you just start your screening right at 20/20 and go from there. If they wear glasses or contacts, you will ask them to have their contacts in or their glasses on. If they normally wear it, they don't have a present for the exam, you document that they do not have their contacts or glasses with them. Okay, eye movement, done with your finger, where you start, and I have them kind of I put my hand on their chin to hold their chin, and they move their eyes up, down in all the different directions, checking the muscle movement of your eyes that has to do with cranial nerves also. Strabismus is a term that has to do with the movement of your eyes. Strabismus is when there's an issue. There's different types of strabismus. You have your 4 terms here. It's esotropia and exotropia. Okay, so esotropia, exotropia. The way I try to remember them, because the X is going outward toward the exit, and the opposite, esotropia, is when the eye turns inward. If both turn inward, some people will refer to cross-eyed, but it can be both turning in or at a downward angle. Hypo, low, hyper, up. So think of hyperactivity being up, revving up, so the eyes turn up, revving down, or hypo, or less, turning down. Exotropia toward the exit, esotropia toward the center. Any of these are a strabismus. A strabismus is just the eyes turning when looking at an object. They can be a constant or it can be intermittent, where it comes and goes, which is different from a lazy eye, which just takes time to turn and focus, which is amblyopia. Okay, let's go on. Here's another picture of esotropia, turning in, exotropia, the eye turning out. And then I, of course, could not put a picture of nystagmus. Nystagmus is an involuntary, rapid, rhythmic movement of the eyeball. Of course, that would take a video for you to see, because it's this movement. That term is nystagmus. All of these strabismus has to do with muscle weakness in the eye. So, nystagmus has to do with muscle weakness in the eye. So your cover uncover test is to test for nystagmus or this muscle weakness. I took out the prior picture I had for the uncover. I felt that one was a little difficult to understand. It's easier looking at this picture. So you cover the eye. This is the eye with the weakness, nystagmus. When you cover the dominant eye, this one moves back into place. And I'm not sure if they still use the terms OD, OS, OU, which they probably do. OD. OD is your right eye, OS is symbol for your left eye, and OU is both eyes. I always remember the whole thing I learned a million years ago. It's all right OD, so OD is your right eye. OS is left eye, OU is both eyes. The next is your confrontation test, which I had in the prior slides too, where you cover, the examiner covers the same eye as the patient is covering, called a visual field test. You take your fingers in from the side. The person should have capture the peripheral vision at 90 degrees. 90 degrees is considered normal. So it's a moving target. 90 degrees is considered normal. So some additional terms: astigmatism is some people wear glasses because astigmatism, it's not their visual, so much the visual acuity. They have a refractory error in their vision because the curve of the lens doesn't adjust properly, so they have to wear glasses to make that accommodation for astigmatism. Your diplopia is the term for double vision. Myopia is the term for nearsighted. That means that they can see near better than they can see far. And then presbyopia is the term for that comes with age, where there's a decrease in the power of accommodation, occurs with age, and so difficulty in changes in vision. Just realize I did not put hyperopia on there, but that is farsighted. Okay, almost there. When you're taking the patient history, these are questions you were asking about ocular problems. It may have to do with stigmatism, astigmatism, cross-eyed. Do they wear glasses or contacts? Have they had surgeries on their eyes in the past, such as cataracts or other things? Have they had traumas to their eye recently or in the past? Major infection of the eye. I think I said glasses or contacts. Have they had changes in their vision? Are they having eye pain, discharge, redness, watery, excessive tearing, dry eyes? Self-care. Do they go for vision exams? Have they been tested if they're 50, older, for glaucoma, exams for the cataracts? Do they wear sunglasses to protect their eyes? Do they take any medications for their eyes, and any medications they are on, because they may also impact their vision? And that is the end of this lecture. Thank you.